another thing that this implant does is it thickens the cervical mucus. When the cervical mucus is thick, then sperm is not able to easily swim through the mucus and come and fertilize the egg. What's up, beautiful people? Welcome to another exciting episode of New Mom with Dr. O. You already know. And today we're continuing with the contraception series. So we've discussed copper ICD, we've discussed the oral contraceptive pills, we've discussed contraceptive injection, and today is for the contraceptive implant. So what's contraceptive implant? So basically, an implant is something that you implant. Let me just put it that way. So basically, a contraceptive implant is like a short plastic rod. So just imagine a matchstick, exactly what a matchstick looks like. But this time, instead of being wood, it's plastic and it's flexible and it's exactly the size and everything of a matchstick. That's what it is. So that small thing contains hormones that help to prevent pregnancy. If you've ever used one before, you know that you can't put it in yourself. It's not implant that you can put in your vagina or your anus or something. No, this contraceptive implant has to be placed under your skin by a doctor. So they'll have to make an incision, place it and close it back, right? And they normally put it somewhere around this area of your skin, right? It's just beneath your armpit, somewhere here. They implant it there. For some women, they are dreading, like, how can they make an incision, blah, 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 blah. But don't worry, many women have gone through it and they survive. Of course, they'll give you something to numb the area so you don't feel the pain. So doctors are not that wicked that they just start tearing you anyhow. No, definitely, you get something to numb the pain. How do these contraceptive implants work, right? So what they do is, like most of the other ones we discussed, they suppress ovulation. And remember, ovulation is the process by which your ovaries release egg, okay? And that egg needs to be fertilized by a sperm in order to form an embryo, which is going to be your baby. So what they do is they interfere with the ovulation, they interrupt ovulation so that your body does not release an egg, so that there will be no fertilization taking place. Not only that, they have to do double barrel. So just in case by mistake the egg was released, that egg was so stubborn, not hear word. Another thing that this implant does is it thickens the cervical mucus. When the cervical mucus is thick, then sperm is not able to easily swim through the mucus and come and fertilize the egg, right? Remember that when you're ovulating normally, your cervical mucus becomes thin and stretchy, so that the sperm is able to easily swim through it. But this does not happen in the case when you're using contraception, right? Like a contraceptive implant, hormonal Oh, by the way, did I mention that contraceptive implant is a form of hormonal contraception? Yeah, I know I mentioned it contains hormone, but I didn't specifically mention it is a form of hormonal contraception. So basically, it prevents the sperm from being able to freely move through the cervical mucus because it makes it thicker. Another thing is that it thins the endometrium. So perhaps by mistake, okay, the egg was released and the stubborn sperm swam through the cervical mucus. It cannot implant it to the uterus because it has thinned out the inner layer, that's the endometrium of the uterus. So it's not making it favorable for implantation. So you can see that there are 3 different defense mechanisms that make it difficult for that pregnancy to happen. But there are still some stubborn babies, though. Very little chance that pregnancy can still happen while using it, but it's a very slim chance. So let me tell you the good thing about this thing. Unlike the other contraceptive pills that you have to take every day, or the injections that you have to go back every 3 months, this one can prevent pregnancy for up to 3 years. 3 whole years. Are you kidding me? 3 whole years of not thinking about getting pregnant. I mean, that is bliss if you ask me, okay? So you only have to remember to go and put in a new one every 3 years, okay? Is this implant for everybody? Again, no. If you have risk factor or have history of breast cancer, then this is not for you. If you have risk of heart attack or stroke or have had blood clots in the past, then this is not for you. And studies have shown that it may not be very effective in women whose BMI is above 30. So if you are obese, then this might not work very well for you. The good thing about this contraceptive, apart from the fact that it prevents pregnancy for up to 3 years, is that immediately you are ready to have your babies, all you need to do is take it out and you can get pregnant within your next cycle, right? You don't have to wait for up to 10 months like in the case of contraceptive injection. You can get pregnant immediately. So that's a plus if you ask me. If you enjoyed watching this video so far, don't forget to click the like button, subscribe and share with anyone you think might need to see this. Remember, being a new mom might be pretty overwhelming, but your kids are totally worth it. See you next week.